SANS have designed the Perinatal Postmortem Consent Package to standardize the way perinatal postmortem consent is taken in the UK. The package is made up of bespoke forms and user guides that are designed to allow health professionals to confidently, sensitively and appropriately discuss and take postmortem consent with families experiencing perinatal loss. The package includes forms taking consent of a standardized perinatal postmortem examination. This form has been relaunched in March 2025. Additional consent forms relating to enhanced organ investigation for diagnostic purposes, and a patient information leaflet deciding about a post-mortem examination. These forms and leaflets have been designed collaboratively by SANS, the Royal College of Pathologists and the Human Tissue Authority, to meet all required standards and elements of legislation. In addition to the SANS User Guide for Consent Takers, the HTA, Human Tissue Authority, Code A, Guiding Principles and the Fundamental Principle of Consent and Code B Post-Mortem Examination, are designed to give practical guidance to health professionals in line with the monitored standards. All of these guides can be accessed on the SANS and HTA website. In addition, there are hard copies available in the Perinatal Postmortem folder which can be found in each clinical area. Anybody completing the form for consent jointly with parents must have evidence of competence, and this is by completing the Wirral University Teaching Hospital (WUTH) training package. This includes completing the e-learning for Health Perinatal Postmortem Consent Package, watching the WUTH Perinatal Postmortem Consent local training video and completing a Perinatal Postmortem passport. Updated changes to service provision and local updates will be updated within the video and disseminated to staff. If you have completed the package but feel you would like additional training, please contact Sarah Weston, Practice Development Midwife, or Hannah Blake, Specialist Bereavement Midwife. In March 2025, new changes to the postmortem consent form have been made. These include changes in some terminology. Page 1 remains a title page. It is important that an MRN is placed on every page. For babies that are no registered, a mother's MRN should be used, but for all babies who have their own MRN number, that should be used. Page 2. This is a removable page for consent takers. This should be read and removed prior to completing with the family. This is a reminder page of the criteria of eligibility, that only trained consent takers should be completing the consent and has Alder Hayes contact details. Page 3 is a key contacts page. This has been mostly pre-filled with relevant contact details for changes or mind and questions. When completing the form, the consent taker should complete the top box that asks for a time and date for who the parents must contact in the circumstances of a change of mind. This must be completed for 24 hours after completion of the form. Page 4 is mostly mother and baby demographic details. Each box needs to be completed. If the answer is unknown, NA must be entered. If the baby has no name, first name can be stated as baby and last name should be the same as mother's. Please ensure all contact numbers are checked prior to completion. In addition to the patient information, this page has instructions on how to complete the form. This includes instructions to fill each box with the word yes or no. This is so that ticks and lines are not used, as these can easily be mistaken for a strikeout and can lead to more risk of error. Page 5 covers the decisions about the type of post-mortem the family would like. There are 3 types of post-mortem to choose from and each has a maximum level of examination. Option 1 is known as a complete or full post-mortem. This is the most detailed post-mortem that involves external and full internal examination or organs, placental examination and tissue sampling and examination. Option 2 is now known as a focused post-mortem, previously known as a limited post-mortem. This includes external examination, examination of the placenta and possible tissue sampling. The only internal examinations that would take place would be on the specific areas indicated by the family. The choices for these need to be selected over the page on page 6. On page 6 you will see the choices for areas for examination of the focused post-mortem. The option of yes or no needs to be completed dependent upon the parents' wishes. For example, if a baby had a suspected cardiac anomaly, the parents may just want the heart examined in detail. This would mean selecting that the chest and neck were examined. The final option for postmortem is an external-only postmortem. This includes no incisions to the baby other than if the family have agreed to genetic testing. A skin biopsy may be performed. Section 2 on page 6 inquires about genetic testing. It is important that parents are aware that even if they consent to genetic testing, this may not be performed. There has been several changes to the nationally agreed criteria for genetic testing, and if these are not met, then genetic testing may not be able to be provided. Page 7 discusses tissue samples that are taken, and parents' wishes for these. If the parents agree to any tissue samples being used for education, training, ethically approved medical research, quality assurance and audit, it does not mean any additional samples will be taken from their baby. Page 8 is the area for signing for parental consent to be given. The answer should be yes for areas to ensure appropriate consent gained. There is an option for the mother and the other person with parental responsibility to sign the form. However, it is not necessary for a second consent, and a mother's consent alone is legally enough for consent. Page 9 should be completed by yourself. At this stage, you should be able to answer yes to all questions. If an interpreter has been utilized, they will also need to sign the form at this stage. Pages 10 to 12 include information and appendices on key aspects of consent taking and clarification on what investigations are performed at each type of postmortem. If at any stage during the consent taking the family's questions aren't able to be answered, then consent taking should be stopped and the answers shall before completion. It is critically important that the form is thoroughly checked for completeness. If there are any errors or missing aspects of the form, this can lead to Alder Hey rejecting the baby for assessment and post-mortem, which can cause significant delay and distress to the family. We have now introduced a checklist due to multiple incidents where babies have been returned and delayed due to missing information. The infant post-mortem consent checklist should be completed and checked by 2 people. Ensuring details on the form are complete. The baby name and details match both the consent form and the request form, and the change of mind form completed. Then this should be countersigned by the 2 individuals checking the forms and the baby. There are several key aspects to consider when taking consent. Firstly, ensure the family have had time to read the parent information about perinatal postmortem consent. Consider any barriers that may affect this, such as language and ability to read. It may be useful to use an interpreter or some of the online information videos on the SANS website. Before beginning this conversation, it is important to know the patient's full history. It is important to know both parents' names, if they have given their baby a name, and the circumstances around their loss. There is never going to be a right time for families to have these difficult conversations. The latest recommendations state that all parents should have the information and option of completing postmortem consent for their baby within 48 hours of their baby's birth or death. It is critical we use our skills as healthcare professionals to assess the clinical situations, appropriateness and parents' wishes to facilitate this. The conversation should always take place in a private and comfortable environment. We use Alder Hey Children's Hospital should not be rushes and minimal to no interruptions should take place. We are usually able to refer and transport baby to unless they have requested this, and should have both relevant consent givers which is 24 hours after the completion of the form has expired. Introduce yourself and explain your role. Most babies will have to begin this conversation is to return to start within what is their current understanding about. However, this can be affected by holidays and capacity. There is no impact on funeral arrangements, as these can go ahead whilst baby remains at Alder Hey. For some cultures and religions, baby must be buried within a few days of their passing. If these parents do wish to have a post-mortem prior to this, it may be able to be arranged as a rapid post-mortem. We are able to discuss these cases individually with Alder Hey, who will aim to accommodate these wishes. However, this is not always achievable. It is important that parents are aware that the results from the post-mortem do take some time. At present, the reports from Alder Hey aim to be completed within 12 weeks. However, this can be subject to change dependent upon individual case requirements. All parents have the 24-hour window following signing the consent form, known as the cooling-off period, to change their mind. Part of the key contacts aspect of the consent form contains the details for who to contact during this time frame to change the process. For families who decline a post-mortem, it can be complicated to then arrange a post-mortem at a later time. However, this may be able to be provided and would require discussion directly with Alder Hay. Some parents will want to visit with their baby after the postmortem and be concerned how they may appear. Most of the incisions that are made during the postmortem may be hidden by clothing or a hat. However, they may be slightly visible upon handling. It is important that parents are also prepared to expect certain changes in baby's appearance that may have occurred due to time, but not the postmortem itself. These are likely to be dry skin, a darkening in color and markings that can look like bruising. These are normal changes that occur after death. We hope this video has updated you and has made you feel more confident and competent to be able to perform perinatal postmortem consent sensitively and appropriately. Please refer to the user guides so that we are all able to give accurate, up-to-date and useful information to parents at this incredibly difficult but critical point in their journey.